back in the studio now, and we're with Leanne Smiley from Home Health Services. And we're going to do some talking about what's going on there, some new hires and some new things that are going on, some changes.
Always change. Change is a wonderful thing, and our home health services here at Green Spring definitely have had some changes over the last few months, and we've had the opportunity to bring some new people on, some new faces. We've also unfortunately had to say some goodbyes along the way, but that's part of what we do. But I think it's important that when we talk that we're letting people know that there are new folks, new nurses and new therapists who might be out in the community providing services. And the area that I work most directly with is certified home health. So that's the area where Medicare or insurance is going to pay for the care. We have nurses and we have therapists, but we also, in our health services area, as we know, have hospice and our home support group as well. And so both those teams have had new hires, and I'm sure when they come on and talk at Village in Motion that they'll bring some of that to the table. We've had the fortune of bringing a new nurse on board, and it's a perfect opportunity to talk about what our nurses do in certified home health. A lot of people in the community know Stella Beeson, and Stella's all over the place, and she's very fast and it's hard to keep up with her. But we've brought Rosalia Parada, and she now completes our composite of flex nurses. And with Rosalia and Cheryl and Sally, who are also our nurses, we're able to provide services under Medicare, which Medicare or insurance will pay for. So the type of things they might do, they do a lot of assessment, especially if someone's coming home from a hospital visit or a stay at Garden Ridge. Also just because their doctor wants someone to see them in the home, that's another reason our nurses go out. Definitely looking at things if someone's got chronic diseases and some chronic disease management. So someone might have congestive heart failure, for instance. So our nurses are checking daily weights. When you've got congestive heart failure, for instance, weighing daily is a really important part because we want to make sure that the blood is pumping properly and not pooling in certain areas of the body. So weighing, making sure that the edema in someone's legs, I think we all have some swelling in our feet from time to time, but someone with congestive heart failure will have more swelling in their feet. So our nurses are definitely able to help monitor that for physicians, because physicians want to know, is that changing on a daily basis? And unfortunately, sometimes with those fluid shifts, people may experience, 3, 4, 5 pound weight gains on a day, and then need some changes in medication. And so our nurses have an integral part of being that liaison with the physician for that to happen. That's just what they do.
Save trips to the medical office.
Absolutely, because the nurse can become that conduit and that conversation. They can also come back with the changes of medication. Maybe someone needs a little more of their fluid pill and things like that. We do a lot with congestive heart failure, but we also work with diseases like diabetes. Diabetes is one that requires a lot of teaching and a lot of monitoring,
I can imagine.
Especially with blood sugars. And if someone's not feeling well for other reasons, people's diabetes does different things. And so there's a lot of changes that may happen with diabetes. Congestive heart, I've talked about congestive heart failure, but chronic obstructive airways diseases, so the bronchitises and the asthmas and everything that occur. And obviously at this time of the year we are very concerned with pneumonias and flu. And at this point,
hopefully everybody has had their shots.
Absolutely.
So it'll be a little less traumatic.
And we definitely are promoting that when our nurses go in. One of the first things they're looking at is, has someone had their flu shot? Unfortunately, by that time they've obviously sometimes been through the hospital system and other things, but definitely promoting that that is one of our preventative measures, because people get very, very sick with the flu and they don't realise how that can impact not just their breathing, but also, as I said, some of those other things that happen at the same time. So our nurses are integral in that type of disease management and assessment. Our nurses are also specialists at wound care, and so if someone has a wound, we're able to work with the patient's physician or even one of the wound care centres. Quite often what will happen is someone might go to a wound care centre once a week for them to manage it, and we work very closely, for instance, with the Inova Wound Centre, but also Virginia Hospital Centre, and our nurses will take those directions and will be able to provide the care on the days that the person's not going. So again, saving those doctor's visits, which is what we talked about. Our nurses are also experts at knowing when other services are needed. So quite often they will go in and identify, that person really could benefit from having physical therapy or occupational therapist. We also have the availability of a home health aide on a very short-term basis if someone just needs that extra boost.
Now, home health care, meaning?
Meaning that someone's having the care in their home.
Okay.
They're not able to leave their home.
Okay.
To have it paid for by Medicare or insurance, what they actually require is that the patient is classified as being homebound. And what homebound means for us is that someone is not doing the things they would normally do. Medicare has some exemptions, and we definitely work with those exemptions. So we're not saying people can't go get their meals or anything like that. But when it comes to socialising and doing some of the social things that people do.
Now, that's not for the nurses to do.
No, but the nurses are the ones that assess whether someone is homebound.
Right.
If we assess that someone could possibly go to outpatient therapy or have their services done at the medical centre or in some other setting, then we're required to do that, because once someone is determined that they no longer are unable to get out of their home, then Medicare says, we're not paying anymore.
Right.
At that point, someone has choices. They can go to the medical centre, they can go to outpatient therapy if it's therapy services they need. We also have our home support nurses. Our home support nurses are privately paid nurses, so they're not covered by Medicare or insurance. They do much the same as our nurses do in home health. Maybe not as much of the follow-up in the acute stage, but they're definitely there alongside us, and they do things like medication management and wound care on a long-term basis.
Oh, okay.
So one of the things that happens when we're getting ready to discharge someone from certified home health, we're definitely looking at what supports they have in the home and whether or not they would benefit from having continued nursing, for instance. And more often than not, the home support nurse is there on the very same day our nurse is there, so they're working very close together to ensure that there's a smooth transition of care, because what we really want to make sure at Greenspring is that if someone needs care, they're getting the appropriate level of care and they're being offered the variety of services that we can offer.
So there are a lot of levels of this care.
There is a lot of levels, and I think that's some of the confusion.
I think it is.
That gets created, especially the difference between what insurance will pay for and what someone has to pay for privately. And it's not always what it was a few years ago. There was many things that we could have done a few years ago that unfortunately we're no longer able to do at this point in time. Things like daily insulins, at one point Medicare would have paid for that. Today they won't. So if someone needs help with insulin, that's where our home support nurses do a fabulous job.
Oh, so the outside nurses do that?
They actually are internal Greenspring employees.
Okay.
They're our sister agency, so they're employees here at Greenspring, all their nurses, but their nurses are able to do that in a private arrangement that they come to with the resident. And for some residents, that's the difference between keeping them independent in their home and having to move to assisted living or skilled nursing. So it's really important that we look at what is it that someone wants, because if it's only one type of service and that you determine that that's what they want, and they're able to stay in their home. That's what all our ancillary health agencies are looking at, is, home health, hospice and home support, is how do we keep our residents active, how do we keep our residents healthy, and how do we keep them living where they want to live.
Right.
The point.
Right. Okay, it's just we need some way to keep that clarified as to what level of care they need, and whether it's an aide, whether it's someone to help with the housekeeping, whether, whatever.
And we're fortunate here, we have a very strong social work department that we work closely with. Social work interacts with all our health services, and so when they're working with a resident and a resident is identifying a need, they're often able to help, work out, is that something that Medicare will pay for or insurance will pay for? They're able to work with us on getting doctor's orders, because, for us, we can only work under a physician's order.
Right.
So we're working very closely with our physicians. Is it an aid they need? And if that's the case, can they bring home support in and get the orders? So we all work very close together when it comes to what a resident needs, especially when a resident may have had a change. You know, a resident's gone to the hospital, they're coming home, they may need some help on a short-term basis. We can provide some, maybe home support can provide some other care to supplement what we're able to do, and then obviously social work's involved in making sure that that resident makes a good transition back to their prior level of function or wherever they were at that point. And we use terms like that, prior level of function, because none of us are saying we can perform miracles, but we are saying that our aim is definitely to keep people, when they do come home from the hospital, they come home from Garden Ridge, to get them back to where they were before they got sick.
Because that takes a lot out of you to be hospitalized.
It does.
And it's amazing how long it takes to get over those 2 or 3 days in the hospital.
I think some people think I can come home and I'll be great the next day.
Right.
That's definitely not the case, especially as we get a little older. We need to let our body rest, and we quite often will go in on people who come home and they're feeling great that day after they get home from the hospital, but 2 or 3 days later they're not feeling so wonderful.
Right.
And that's where the benefit of having these services on site here at Greenspring, and having people who have the eyes and ears to be able to initiate services. We can do it at that point in time. For continuity, we would hope that we're getting that referral before you even leave the hospital, so that we know that you're coming home. We know that there might be a need for services, and if it's not the hospital, Greenspring, Garden Ridge, they work very closely with us. We know when residents are coming home that might need services as well, so that we can be there maybe the next day, even if it's just to get us started and see what we need, and then determine whether or not therapy services or additional social work services or aid services might be needed.
Just to adjust to the differences that have been caused. Yeah.
Well, sometimes when someone has been in a facility such as Garden Ridge, they do their therapy and they're very good and they're doing really well with therapy. It's a little different when they come home and their home environment is not set up like the room was or the gym was within the facility. So we definitely have physical therapists and occupational therapists who are able to go in and look at that home environment. And as a nurse, and that's my clinical background, I can go in and say, there's furniture that we have to move, or there's rugs that we have to move for safety, because we're definitely looking at safety and how someone stays safe when they go home. But it's a little different. Your toilet setup might not be what it needs to be. You might need some additional equipment. Occupational therapy is very good at helping with the suggestions, and then works with general services to make sure that we can get that installed. So I think when we think about health services here at Greenspring, they are all very connected in many ways. And it's not just a delineation of this level or this level or this level. It's more of a circle. Everyone's working together, and we create that spider web sometimes.
I think sometimes it's more a matter of knowing who to contact when you think you need some help. Who do I call?
And I think the first call would always be, from my perspective, for a resident here, would be to their social worker.
To the social worker.
Every resident here at Greenspring is assigned a social worker.
Yes.
Those social workers may have only made contact once or twice in the past if there was something, but those social workers are truly the conduit for knowing what those resources are.
Okay. That's good to know.
And
if you kind of feel like, I really need some help, but I'll check it out with my social worker.
And there will be some opportunities going into 2017 for our residents to learn a little more about the services here at Greenspring. There's an initiative that we've been working on this year to get it into a written and an oral presentation, so that we've just sent it out with our staff, so our staff now know what all the services are in all the departments. But we'll be doing the same with residents coming into the new year, so there'll be opportunities for maybe some forums to come and learn about all the different services and how they connect.
Maybe a town hall where questions can be asked. And
absolutely. I think those are the wonderful suggestions and things that I know our leadership is taking on, and making sure that we are communicating, because one of the biggest problems I think we have in a community is not everybody knows what needs to happen. Where do I go? What do I do? How do I access something? Oh, I heard someone say that maybe there's something, but I'm not quite sure.
Right.
And as I said, at this point in time, I think using your social worker is a wonderful way of looking at I'm only just going to ask a question. I don't maybe need a whole lot from them, but I can ask a question, and they can guide me in what I need.
Okay, well, thank you so much. I think we all learned a little bit today about our home health situation, and maybe we'll know a little more about who to call when we need something.